Up next, we're going to keep it moving with our first interview of the afternoon, Dr. Dr. Kostrzewski. So Dr. K, to most, including his colleagues and patients, is a graduate of Tufts University School of Dental Medicine, where he graduated in 1992. He completed his general practice residency at the university in Stony Brook in 1993. Dr. K was a clinical instructor at the prestigious Hornbrook Group in Chicago. There he trained other dentists in cosmetic dentistry and full mouth rehabilitation. Dr. K has published several articles featured in dental journals such as Dental Town, the Crown Council, and the Dental Leader. Dr. K is also known as Coach K. This is due to the fact that his flair for creating passionate teams. In 2000, Coach K founded The Winning Dentist, a team of consultants that help others develop passionate teams, functional work systems, and provide motivational and congruent marketing. Dr. K puts an emphasis on treating the medically compromised patient, dental trauma, sedation, and treating the fearful dental patient. Would you please put your hands together and welcome Dr. K to the stage. All right, can I have a seat?
Thank you. Thank you for having me.
Thank you for coming. I appreciate you coming on my show. Okay. So what exactly do you do in your practice?
Well, again, let me say thank you, and it's an honor and pleasure to be here today. Thanks for having me. In our practice, we change people's lives by creating the smile and function they desire in a comfortable and caring atmosphere.
Okay.
We're a family practice. We do cosmetics, reconstruction, and I have an affinity for helping the fearful patient as well as helping athletes prevent trauma.
Okay. What does a fearful patient look like for you?
So many people are afraid of the dentist.
I'm one of them. I can agree with that. I avoid going to the dentist at all costs.
Dentistry gets a bad rap. I mean, we get a bad rap on TV, in the movies. It's just not fair. Dentistry doesn't have to be painful. It doesn't have to be something people need to fear. Mm-hmm. But they're out there. I mean, half of the population doesn't go to the dentist in a given year, be it whether they have dental insurance or don't have dental insurance, or I think a lot of those people are just afraid. They've had a traumatic experience in the past, and that
affects how they see perceive dentists and everything now.
Sure.
Say I was coming to you and I'm a fearful patient. How would you calm me down in your office?
So we make it a fun place to come. You know, we try and lighten it up. It shouldn't be stressful getting there, but I have lots of patients who will sit in the parking lot for hours in the car before they come in for the first time.
Wow.
And there's people that are afraid. But we do sedation dentistry, no needles. You take a small pill, mm-hmm. and you can sleep through the whole procedure of what you need done.
Wow, I've never heard of that before.
Yeah.
they like that.
So, I mean, you wouldn't think of having your tonsils or appendix out
without sedation.
Sedation.
Yes.
You know, dentistry shouldn't be any different. And you know, more dentists need to realize that people are afraid to come to the dentist and make it a better experience.
Now, when you say trauma in terms of dental trauma, can you describe to us what exactly that means?
So yeah, my affinity for dental trauma is, I did my residency in a level 1 trauma center at University Hospital at Stony Brook. And, mm-hmm. you know, when people get in a motor vehicle accident, they head and neck injuries, typically the first person they see is a dentist or an oral surgeon.
Right.
Orthopedic surgery, ENT, dentistry, all works pretty closely together. But my affinity is to educate parents and youth athletes. Whoa, how not to get hit in the face with a baseball.
Oh, well, yeah, that's important. Or a stand.
There you go.
Sorry about that.
That was good timing. I didn't have my mouth guard in. So, yeah, trauma in sports, mouth guards. Most of us would think, you know, what sport comes to mind that an athlete doesn't have their teeth? To you, what's the first sport that comes to mind?
Football. Football. Getting hit in the face. Rugby. Rugby is a big one. That's pretty contact.
And ice hockey.
Yeah. Okay. Oh, yes.
So who thinks there's more facial tooth trauma in ice hockey or baseball? Ice hockey. Basketball or ice hockey? Basketball has more injuries to the
Wow.
face and teeth than ice hockey does. Ice hockey players up to the collegiate level wear full face mask, a
They do.
professional mouth guard, and it's almost impossible to have a facial injuries. Now, at the professional level, every single NBA player is wearing a professional fitted mouth guard, and most of the time it's clear, so you don't even realize it. But they're not wearing. We buy our kids. We want all our kids to be a professional athlete, right, or a professional actor or something like that. We buy them the best athletic equipment there is. We buy them the
Yes.
best skates. We buy them the best baseball glove, whatever it is, best sneakers. And then we go down the aisle at the sporting goods store, we see the mouth guards, and there's the $10 mouth guard and the $30 mouth guard, and we like
We
just
don't put out the
get
best.
the color or the $10 one, you're out of there. And the kids can't breathe with it. They
wow.
can't speak with it. Communications is very important in sports.
Yes.
All right? So they can't breathe with it, they can't speak with it, it's not fitting right, it's not doing any good. And most kids they're just hanging out the side of their mouth like this, not doing them any good.
Would you have a recommendation for
So-
that?
Every professional athlete is wearing a professional mouth guard made by a dentist. And you think, okay, well, they're pros. They have millions of dollars. They get them for free or they have plenty of money. But the fact is, a professional fitted mouth guard by a dentist it's more money than the $10 one at the sporting goods store.
But it's more protection.
It's fitted properly. It can breathe properly. It's protecting properly. You know, and it's less than the Michael Jordan sneakers or the
How much do
Wayne-
Michael Jordan sneakers go for these days?
A lot, and ice skates are even more than that. So we'll shell out $500 for ice skates, or
But not enough for a
whatever,
mouth guard.
But then not the mouth guard, and the kids aren't protected properly.
Is there like an association that is starting to bring awareness to this problem, or
There
anything
is
of
an
that
association.
nature?
There is association of I can't think of the name of the association on the top, but there is. But basically, any dentist can make you a properly fitted mouth guard.
Right. Well, that's important. Mouth guards seem to be. I would never have thought that basketball would be one of the sports where you would
Because you
need
get an
that
elbow.
protection.
Yeah, you're not wearing the cage that a football player is wearing or a hockey player, and you're going to get an elbow in the face.
Mm-hmm.
Soccer and baseball are just as bad.
Okay. Okay. Well, thank you for that bit of information. I
Sure.
learned something new today. That's for sure. Now, in your practice, what are some of the common things that you see on a daily basis?
So like I brought up, the fearful patient because I really focus on that. But we're a general practice. We practice complete health dentistry. There's dentistry moved away from medicine a long time ago, and now I think it's coming back together. People are understanding that you have a healthy mouth, you have a healthy body. So complete health dentistry is just recognizing that there's an association between gum disease and heart disease.
Right,
And
exactly.
you're
That was going to
probably-
be my next question.
Sure.
So asking about, people with gum disease, what can they do to help that?
Mm-hmm.
People that floss and they bleed and such, because there are a lot of people that are affected by that. And I know
Mm-hmm.
if you don't take care of yourself, certain things can lead to heart disease. And then
Right.
you're even in more turmoil than you were before.
Right. So there's an association between the two. It's not a direct link, but if you brushed your hair in the morning and your scalp is bleeding, you're going to go to the hospital probably.
Yes.
Right? There's something wrong. Well, if you brush or floss and your gums are bleeding, there's something wrong there as well. So it starts with proper nutrition and taking care of your mouth, brushing your teeth a couple times a day. I prefer a sonic brush compared to a manual toothbrush.
Okay. There's benefits to that better than a manual?
It makes the job more efficient. There's no reason why you can't get the job done with a manual toothbrush, but a
Okay.
sonic toothbrush is going to make it more efficient. And flossing just once a day. I'm sure everybody out here flosses. How many people out here floss? Come on. There's some. It's good. It's 50-50. It's a hard habit to develop because
It is.
we don't floss when we're kids because kids' teeth you really don't have to.
Mm-hmm.
So, but flossing once you're over 18, flossing is more important than brushing. Almost. You still need to do them both, but flossing.
Flossing is more important.
You only have the floss teeth you want to keep.
Hopefully it's all of them. Hopefully you're not missing
Yes.
any. Now I'm going to pick your brain about one last thing. What are your thoughts on a water pick?
So a water pick is going to help for people that really don't like to floss, what floss does is get the oxygen out of the gums and kills the anaerobic bacteria. So it's not the mechanical issue of flossing, unless you're eating at the barbecue and you get some grizzle stuck between your teeth, the floss is going to get that out mechanically. But on a regular basis, what you're doing is you're getting oxygen out of the gums to kill the anaerobic bacteria, which causes gum disease.
Right.
And we all have bacteria in our mouth. It's normal.
Yes.
You wake up with morning breath. So a water pick is going to help oxygenate under the gums as well and kill that bacteria. So it's very good.
Perfect. So water picks, flossing.
Sure.
Any other tips that you can let us know about our dental hygiene?
About dental hygiene, if you're healthy, you should be going to see the dentist twice a year. And if your gums are bleeding, you probably should go in more frequently. Another oral systemic link with dentistry is most people don't know that snoring or sleep apnea can be treated with an oral appliance. And some people may have heard of a CPAP.
Yeah, CPAP machine.
Which is one way to treat sleep apnea. If you have mild to moderate sleep apnea, an oral appliance can help. Or if you're anybody out here have a partner that snores, that could be corrected at the dentist as well.
Perfect. Well, I thank you for being here today. Now, where is your practice, just in case any of us want that sleeping pill?
Sure. It's stonyhilldental.com. It's in Bethel, Connecticut.
Perfect. All right. Well, thank you very, very much, Dr. K. I appreciate you being on the show today.
Thanks for having me.